State, as part of Nigerian Federation, is bound by standards on violence against women and girls ratified in Nigeria and applicable. These standards are CEDAW, the African Charter on Human and People's Rights, on the rights of women in Africa, the Sustainable Development Goals, VAWG, and Lagos State has enacted its own laws and established institutions that tackles these problems. We see that in chapter 3, in part 3 of this publication on Lagos State, in 2003, 43.9% of women and girls in the state have experienced physical violence, which is higher than the national average of 27.8%. On experiences of physical violence, it decreased in 2018, while sexual violence increased by 7%. In 2013, contrary to the Child's Rights Act and Child's Rights Law, which is established by Lagos State, 10.9% of girls had experienced early child marriage, and we see that they don't give consent, being that they are less than 18 years. Also, we see cases of female genital mutilation, which is 34.8% in 2013. It decreased, however, in 2018 to 23.7%. On education, we also see that there is a back and forth movement in education which has not been explained. But it's impressive that the completion rate increased. However, for secondary school, senior secondary school, there is a low percentage, and this needs to be looked into by way of monitoring and evaluation. We have, in chapter 4, certain MDAs listed out: Ministry of Women Affairs and Poverty Alleviation, Education, Health, Youth and Social Development, BSVRT, domiciled in the Ministry of Justice. The budget implications and availability of budget for these ministries that tackle these issues of sexual and gender-based violence, violence against women and girls, harmful practices, and issues of SRHR. We have recommendations for the executive, for the legislature, and civil societies too. We noted that in the executive, there is need for an open and clear budget for this budget process for the public, for the needs of women and girls. They need to prepare and publish quarterly budget implication reports showing releases and cash-backed projects. There's also need for release of sums as a matter of course and routine, and when there is paucity of funds, send a budget amendment bill to the legislature to amend the budget to reflect the fiscal realities. There are other recommendations for the ministries, but however, on legislature, we ask that they tackle steps that they take steps to ensure that the duty to appropriate funds on a yearly basis is done in accordance to the best practices and that ties expenditure with policy goals and objectives. They need to provide details of appropriated sums in the Appropriation Act and schedule on a line item basis to ensure clarity and transparent budgeting. For civil societies, we have always recommended that there be collaboration among civil societies and that they organize sensitizations for the needs of women and girls. For Federal Capital Territory, we see that the good thing about Federal Capital Territory is that they don't have their own separate legislature that makes laws. They enjoy and benefit from the National Assembly. So laws like the Child's Rights Act, the VAP Act, and other relevant national policies are applicable to the FCT. So with this, we see FCT doing well on certain issues, but however, we still have problems that are notable, from women experiencing physical violence, from the percentage of circumcised women in the national average, which is not impressive, to the rate of teenage pregnancy. Also, we see in education there is need for girl inclusion. There is women inclusion in education has been low. These problems can be tackled through implementation of existing legal and policy frameworks in the policy, plan, and budget continuum, using smart and targeted strategies to reduce SGBV, VAWG, HP, and improve the SRHR of women and girls. We also noted that budgets and budgeting towards elimination of all these vices can be improved through mainstreaming women in our policy makings. On our recommendation for Abuja, we have for improved funding for the eradication of SGBV, VAWG, and HP, prenatal and postnatal care for women, including access to emergency obstetric care for mothers in the FCT, family planning goods and services need to be made available to these women too. For SGBV response team, we need capacity building for all these agencies that fight these vices. Incidentally, our organization has trained some of these people, these agencies, the law enforcement and MDAs that are applicable to these vices. For clear costed plan that we need to set out for this, for SGBV, VAWG, and HP, and SRHR, we need to make sectoral objectives and policies that are linked to available resources in a sound fiscal framework. For civil society, we need to organize sensitization and capacity building programs to improve knowledge and skills on the subject matter. That's all for FCT in brief.
Okay, gentlemen and ladies, the